Hi, this is Frank again with a frank opinion. It looks like the healthcare reform debate is going to be back on the table right after the congressional recess. And I thought I'd like to share with you some ways of looking at, quote, public policy. I really think that most Americans don't realize how simple and actually energizing and how necessary thinking about public policy is so that we can bring our country to a much better place. And a lot goes into the words that one uses in order to establish a public policy goal. So if it's healthcare reform, is the goal universal access or universal coverage? And I would argue with you that the difference of those two words, access and coverage, are huge. Or as Bernie Sanders might say, huge. And let's look at what has happened so far. The ACA, the Affordable Care Act, otherwise known as Obamacare, yes, it did some good. It gave millions of Americans access and in fact coverage with regard to health care. But it left 30 million Americans uninsured. As the word with regard to healthcare reform became access and affordability, we'll get to that, as opposed to universal coverage, we had proposal after proposal coming out of the Republican Party that in fact would produce more uninsured than less uninsured. Anywhere between 16 million and 28 million additional uninsureds to the current 30 million Americans that are presently uninsured. So how is that good public policy? I would argue that when President Obama was in office in his first year and decided to choose healthcare as his number one priority, that he might have used the word universal coverage as opposed to universal access, and that even if it was a plan that would take 1 year, 2 years, 3 years to achieve, the goal would be universal coverage. So if you agree with me that universal coverage is the policy goal, then you look at legislation. And we now have, as you know, as most of you might know, H.R. 676, Congressman John Conyers' fabulous piece of legislation called the Expanded and Improved Medicare for All Act. It's going to be hard to beat. Senator Bernie Sanders hopefully will be introducing, he's indicated such after the congressional recess, his companion bill on the Senate side, and most of us hope that it will mirror H.R. 676, which is a wonderfully crafted bill. So once you establish universal coverage, every American insured, you then go into what are the sub-objectives, sub-policy goals under that big policy goal, that number one policy goal of universal coverage. Well, then you might say accessibility, very important. If you're in a rural community that doesn't have health clinics or hospitals or doctors even close by, you may want to say another important policy goal below universal coverage is accessibility. If you want to improve upon the current healthcare policy that we have, the ACA, and make it more robust, include more things, you may say, we want to include in this universal coverage greater benefits. Not a better deal like the Democratic moderates, blah, blah, blah. No, a great deal, great additional benefits in our universal coverage policy. So we might include rehabilitation, long-term care, dental, vision, mental health. Those are all included in H.R. 676, by the way. We might include as a sub-goal, policy goal, objective, simplification, so that people do not have to become experts in healthcare insurance, so they don't have to make choices, so that they don't have to have co-pays and deductibles and premiums to worry about, etc. Simplification might be another important one. H.R. 676 does that. you may get to affordability. And by the way, H.R. 676, in terms of its implementation and ways of financing it, which I'll go into in the very next video, actually produced a cost saving, a boost in household income for fully 95% of Americans. But we'll get to that in the next video. So, as you can see, it's important to choose the right word. Is it universal coverage? And then you go below that and list the other things that you want to achieve? Or is it universal access? I will argue with you that as we come back from the congressional recess, and the Republicans probably put on the table once again something that has to do with repeal and replace and call it, whatever they're going to call it, that it's still not what we as Americans, as this country should have. As Bernie Sanders has repeated infinite amount of times, we are the only country that does not have universal health care, and yet we are the richest country in the world by far. Share this with your neighbors and friends and relatives, because at your next dinner meeting or table, you may want to have a bottle of wine, some apple cider, or whatever the case may be, along with your meal. Have an extended one, and then choose a topic, whether it be education or infrastructure, and decide amongst yourselves as Americans. Play with it. It's not monopoly, but play with it. What would you do in crafting and wording a public policy? Thanks.